Heart attack. A heart attack happens when the progression of blood to the heart is obstructed. The blockage is frequently a development of fat, cholesterol, and different substances, which structure a plaque in the arteries that feed the heart, coronary veins. Some of the time, a plaque can crack and frame coagulation that squares the bloodstream. The interfered bloodstream can harm or obliterate a piece of the heart muscle. A heart attack, additionally called myocardial infarction, can be lethal, yet treatment has improved drastically throughout the long term. It's vital to call 911 or emergency medical assistance in the event that you figure you may be having a heart attack. Side effects. Normal cardiovascular failure signs and side effects include pressing factor, snugness, pain, or a crushing or throbbing sensation in your chest or arms that may spread to your neck, jaw, or back. Sickness, acid reflux, indigestion, or stomach pain. Windedness. Cold perspiration. Exhaustion. Wooziness or abrupt discombobulation. Cardiovascular failure indications fluctuate. Not all individuals who have coronary failures have similar manifestations or have similar seriousness of indications. A few groups have less than overwhelming pain, others have more extreme pain. A few groups have no manifestations. For other people, the primary sign might be abrupt heart failure. Notwithstanding, the more signs and indications you have, the more prominent the possibility you're having a coronary failure. Some cardiovascular failures strike abruptly, however, numerous individuals have cautioning signs and side effects hours, days, or weeks ahead of time. The soonest cautioning may be repetitive chest agony or pressing factor, angina, that is set off by movement and alleviated by rest. Angina is brought about by an impermanent lessening in the bloodstream to the heart. When to see a specialist. Act right away. A few groups stand by too long on the grounds that they don't perceive the significant signs and side effects. Make these strides. Call for crisis clinical assistance. In the event that you presume you're having a coronary episode, don't stop for a second. Promptly call 911 or your nearby crisis number. On the off chance that you don't approach crisis clinical benefits, have somebody drive you to the closest clinic. Drive yourself just if there could be no different choices. Since your condition can decline, driving yourself puts you and others in danger. Take dynamite, whenever endorsed to you by a specialist. Accept it as educated while anticipating crisis help. Take ibuprofen, whenever suggested. Taking anti-inflammatory medicine during a cardiovascular failure could decrease heart harm by assisting in withholding your blood back from coagulating. Ibuprofen can associate with different drugs, be that as it may, so don't take a headache medicine except if your PCP or crisis clinical staff suggest it. Try not to postpone calling 911 to take ibuprofen. Call for crisis help first. What to do in the event that you see somebody who may be having a cardiovascular failure. In the event that you see somebody who's oblivious and you accept as having a respiratory failure, first call for emergency medical assistance. At that point, check if the individual is breathing and has a heartbeat. On the off chance that the individual isn't breathing or you don't discover a heartbeat, just should you start CPR. Push immovable on the individual's chest in a genuinely quick musicality, around 100 to 120 compressions per minute. In the event that you haven't been prepared for CPR, specialists suggest performing just chest compressions. On the off chance that you have been prepared in CPR, you can go on to opening the aviation route and salvage relaxing. Causes. A cardiovascular failure happens when at least one of your coronary courses gets obstructed. Over the long haul, a development of greasy stores, including cholesterol, structure substances called plaques, which can limit the conduits, atherosclerosis. This condition, called coronary corridor illness, causes most respiratory failures. During a coronary failure, a plaque can crack and spill cholesterol and different substances into the circulatory system. Blood coagulation structures at the site of the burst. In the event that the coagulation is huge, it can impede blood move through the coronary vein, keeping the heart from oxygen and supplements, ischemia. You may have a total or incomplete blockage of the coronary conduit. A total blockage implies you've had a straight rise in myocardial dead tissue. A fractional blockage implies you've had a non-street rise myocardial localized necrosis. Analysis and treatment may be distinctive relying upon which type you've had. Another reason for cardiovascular failure is a fit of a coronary conduit that closes down the bloodstream to some portion of the heart muscle. Utilizing tobacco and unlawful medications, like cocaine, can cause a perilous fit. Contamination with COVID-19 additionally may harm your heart in manners that bring about a coronary episode. Hazard factors. Certain components add to the undesirable development of greasy stores, atherosclerosis, that limits conduits all through your body. You can improve or dispose of a considerable lot of these dangerous components to diminish your odds of having a first or another coronary episode. Respiratory failure hazard factors include age. Men age 45 or more seasoned and ladies age 55 or more established are bound to have cardiovascular failure than are more youthful people. Tobacco. This incorporates smoking and long-haul openness to used smoke. Hypertension. After some time, hypertension can harm veins that lead to your heart. Hypertension that happens with different conditions, like weight, elevated cholesterol, or diabetes, builds your danger considerably more. High blood cholesterol or fatty oil levels. A significant degree of low-thickness lipoprotein, LDL, cholesterol, awful, cholesterol, is well on the way to limit veins. An undeniable degree of fatty oils, a kind of blood fat identified with your eating routine, likewise builds your danger of cardiovascular failure. Be that as it may, an undeniable degree of high-thickness lipoprotein, HDL, cholesterol, great cholesterol, may bring down your danger. Corpulence. Heftiness is connected with high blood cholesterol levels, high fatty oil levels, hypertension, and diabetes. Losing only 10% of your body weight can bring down this danger. Diabetes. Not delivering a sufficient chemical discharged by your pancreas, insulin, or not reacting to insulin appropriately causes your body's glucose levels to rise, expanding your danger of coronary failure. Metabolic condition. This condition happens when you have heftiness, hypertension, and high glucose. Having metabolic disorders makes you twice as prone to create a coronary illness as if you don't have it. Family background of coronary failures. On the off chance that your kin, guardians, or grandparents have had early coronary episodes, by age 55 for guys and by age 65 for females, you may be in expanded danger. Absence of actual work. Being latent adds to high blood cholesterol levels and heftiness. Individuals who practice consistently have better heart well-being, including lower circulatory strain. Stress. You may react to pressure in manners that can expand your danger of cardiovascular failure. Unlawful medication use. Utilizing energizer drugs, like cocaine or amphetamines, can trigger a fit of your coronary courses that can cause a heart attack. A background marked by toxemia. This condition causes hypertension during pregnancy and builds the lifetime hazard of coronary illness. An immune system condition. Having a condition, for example, rheumatoid joint inflammation or lupus can expand your danger of a coronary. Inconveniences. Inconveniences are frequently identified with the harm done to your heart during a coronary failure, which can prompt unusual heart rhythms, arrhythmias. Electrical short circuits can create, bringing about strange heart rhythms, some of which can be not kidding, and may prompt passing. Cardiovascular breakdown. A coronary episode may harm such a lot of heart tissue that the excess heart muscle can't siphon sufficient blood out of your heart. A cardiovascular breakdown can be brief, or it tends to be an ongoing condition coming about because of broad and perpetual harm to your heart. Unexpected heart failure. All of a sudden, your heart stops because of an electrical aggravation that causes an unusual heart musicality, arrhythmia. Coronary failures increment the danger of unexpected heart failure, which can cause passing without quick treatment. Avoidance. It's never past the point where it is possible to find ways to forestall a coronary failure, regardless of whether you've effectively had one. Here are approaches to forestall a coronary. Drugs. Taking meds can decrease your danger of an ensuing heart attack and help your harmed heart work better. Keep on taking what your primary care physician recommends. and ask your PCP how frequently you should be checked. Way of life factors. You know the drill. Maintain a solid load with a heart sound eating regimen, don't smoke, practice routinely, oversee pressure, and control conditions that can prompt a cardiovascular failure, for example, hypertension, elevated cholesterol, and diabetes.